there, and welcome to this conference hosted by MS Focus, the Multiple Sclerosis Foundation. I'm your host, Deborah Foreman, Educational Programs Coordinator for MS Focus, and I'm joined by Cherie Binns, who's here today to answer your MS-related symptom management questions. Now, I'd like to introduce her. Cherie Binns is a registered nurse with an additional degree in gerontology and is also an internationally certified multiple sclerosis nurse. She's our patient healthcare liaison, a writer for our MS Focus magazine, and a regular presenter of patient educational programs for the Multiple Sclerosis Foundation. Cherie was diagnosed with relapsing remitting MS in 1994 and has found that adopting some changes in her lifestyle has made her MS much easier to manage. We're pleased to have her join us today. Cherie, thank you so much for being with us, and I'm going to turn it over to you and we can start with the questions. But let me tell everyone first, in case they haven't been here and they're not familiar with how to ask a question, let's give them a little information. So for all of you that are unfamiliar with this, if you do have a question for Cherie, you're going to submit your question through the app, and which means it's going to allow you to send your question anonymously if you like, or you can actually put your name. You can also ask your question live by raising your hand, and to do so, just click on the raise hand button, or you can press *9 if you're on your phone. So I'm going to call on you then, and then you'll just unmute yourself, or Cherie will do that. Okay, so now I don't know if we have any questions yet, but let's take a look.
I don't see any.
Hey.
I did get a couple of questions emailed to me from an anonymous attendee. And one of them is related to LDN or low dose naltrexone. It's a compounded drug, which is a very, very, very low dose of a drug an older drug that's been repurposed to help manage MS symptoms. It is not approved by the FDA for that, but is relatively widely prescribed, more so before the advent of our disease-modifying therapies. Many people were taking LDN at 3 and 4.5 milligram doses. The normal dose for substance misuse treatment is 100 milligrams. And so this is a very, very small dose of that drug, and it has to be done through a compound pharmacy. The question is, how well does low dose naltrexone 4.5 milligram work for MS pain? I think that's a very individual answer. For some people, it seems to work very well. Anecdotally, LDN seems to work better for older individuals who've had MS for a longer period of time, secondary progressive MS instead of relapsing remitting MS. And until very recently, there were no other drugs formulated especially for secondary progressive MS. So it was almost an only option for many people. And they found that they were sleeping better, they were in less pain, their spasticity was a little bit less intense with that drug. I personally took it several years ago, and I found it did not help the pain that I was having at all. So some people have said that it helps their pain, and I would have to say that you're certainly welcome to have that conversation with your doctor about whether or not they want to give you a trial dose of it so that you can see whether or not it works. And I would say within 3 or 4 days, you would notice whether or not it was going to be helping you. It's not something that you really need to build up blood levels with. The other question that came in advance is, are there successful treatments for sciatica and foot drop? Exercise, medicine, vitamins, etc. I would say both for sciatica and foot drop, a physical therapist is the place you want to start. They can treat both relatively effectively. Vitamins don't even enter into the treatment of either of those. So I would just take that off the table altogether. Medicine If the sciatica is extremely severe, medication to relax the spasm or to deal with the nerve pain that sciatica causes might be in order, but probably not until after it has been a continuous pain for at least a couple of weeks. As far as medication for foot drop, no, there wouldn't be any. I see a question in our Q&A, and this is from Elizabeth. She said, what are your thoughts on MRI with contrast for inactive SPMS, secondary progressive MS? I don't think we need contrast for the most part, except if we are having new symptoms at least 6 months to a year after a medication change. If you are having new symptoms after your medication has been started or changed to something more effective, then you may want to have an MRI done with contrast to see if there are changes from the previous MRI and there's actually active disease process going on. Elizabeth also follows up, do you have any information on sarcopenia specifically related to MS despite resistance training? I really don't, Elizabeth, and I'm sorry, I can't help you with that. Okay, in the chat from Jeannie, I have, what percentage of people with MS have their left leg or foot issues? Most of us have one side or the other that's more impacted, and it doesn't seem to show favorites. For me, my left side is affected. My right side is not. So most of us will have issues on one side or the other if we're having pain or weakness or spasticity. It generally tends to be worse on one side rather than the other. Okay. I also moderate our Facebook pages for the foundation. There are 4 Facebook pages. We have a large private page that people can't see who is posting on it. They can't see what's posted until they're a member. So there is some privacy as to what you ask for that. We also have a Facebook page for people who are diagnosed with MS, no one else, not a significant other, not somebody who doesn't have an official MS diagnosis, and that's called MS Focus Confidential. We have a private Facebook page for MS Care Partners only, and that's for individuals not living with MS, but who have a significant other in their relationship circle that is living with MS. And then our most recent group is for the MS focus on the LGBTQ community. So those are individuals with either with MS or with a loved one with MS, and somebody in that relationship identifies as being a part of the LGBT community. If you have questions, please type them into the Q&A or into the chat. Just ask a simple question. I don't really need a backstory on your question, and I will ask if I need clarification on that question. There have been a couple of posts on our Facebook pages in the last week about a new potential vaccine against MS that can reverse some of the symptoms of MS. This has worked in animal models. It has not been tried on humans yet. So they are you're likely to be starting to see some recruiting posts going out, or if you go to clinicaltrials.gov and look for MS vaccine, you may see something about that to recruit. We don't expect it's going to do myelin repair or repair the damage that's already there, but it may help to ratchet down some of the symptoms you may be experiencing. Reposts in the Q&A, my physical therapist is working with me on foot drop, but we noticed that the foot tires out extremely quickly, less than 3 minutes. What do you think about she says the Nest 300, i300, but it's the BioNest i300. The BioNest i300 works with an electrical stimulation to the nerve on the side of the leg that causes the foot to go up and down. And it helps to fire that so that your foot's not tiring as quickly and it's not dropping as quickly, so that you're not tripping over that toe. Unfortunately, it's sometimes difficult to try one of these out, and they're not fully covered by insurance. They're quite expensive, generally around $3,000 or $4,000. Insurances usually cover about 80% of the cost, but it sometimes is difficult to try that without actually buying it first. So that's a question to address to your physical therapist. I know many people who've used that, and also the walk aid, which is similar to that, with great effect. Andrew asks, what lifestyle changes helped you live with MS? There's so many, Andrew. I think there are two big categories. One is what you eat, and the other is how you move. Exercise is absolutely essential to stay active and minimize our symptoms with MS. And I'm not talking about, high impact aerobics or anything like that. I'm talking about moving purposefully, at least half an hour every single day, whether it be a walk, whether it be lifting weights. I'd kind of recommend that you alternate your aerobic activity with your strengthening activity. So one day you might do a series of exercises with weights, and another day you might do a long walk. A physical therapist is really good at helping you target what to do according to your ability levels. You don't want to start something if you've been inactive without some input from a physical therapist, because you don't want to hurt yourself and you don't want to tire yourself out. As far as what you put into your body, sugar is the biggest inflammatory food category that we put into our bodies. And so the more we can limit sugars, particularly refined sugars, the better. The less, I know that when I eat sugar, my pain level ramps up, my fatigue level ramps up, my spasticity ramps up. And it's going to take about, I would say, 3 to 4 weeks for the abstinence from those added sugars to really show you some benefit. But I personally find that if I have a dessert, something like a cookie or a small piece of pie, within literally by the next day, I'm more fatigued. Jeannie asks, what new findings are there in stem cell research? We're still finding with stem cell research that people are doing very well in the year to 5 years following the stem cell therapies. And these are human stem cell therapies or homologous stem cell therapies. HSCT is the abbreviation for that, not for adipose stem cell therapies. Those are not valid therapies. They're costly and they're not valid. Stem cell replacement or stem cell treatments generally run quite expensive. I would say close to $500,000 per person for one round of stem cell therapy. Most people's insurance covers a good bit of that if needed. But what we've seen so far is that most people that have had this get back to that baseline pre-stem cell transplant within about 5 years. So while it initially looked like it was a cure, it doesn't seem to be, but it does often give a good 5-year respite from having to take disease-modifying therapies. Let's see. Jody says, what do you think of taking taurine and what dose would you recommend? Jody, I'm not sure what taurine is, so I can't really answer that question. I'm wondering if there's another name for it. Kathleen says, I've tried cognitive therapy and I didn't find it very helpful. The therapy was for 12 weeks. I have real difficulties with word finding and organization. Any suggestions? I don't know what kind of cognitive therapy you did, Kathleen. If you did it in an online program, if you did it working with a speech therapist. There are cognitive therapies out there that are sort of canned therapies. They're a generic. They're not tailored to the individual. The cognitive retraining that I did when I needed that to kind of stay active in my profession, probably 20 years ago, I sat and I worked with a physical therapist, and they just really grilled me about what I needed to stay active in my work. They worked with my job description, and they basically tailored what they were doing with me to what I needed to stay sharp and active. A generic program that you're getting online is probably not going to be all that beneficial for MS cognitive issues. Elizabeth asks, why does humidity, independent of heat, worsen MS symptoms? Because humidity will magnify the heat. So very dry heat, such as you might find in Arizona, for example, you could have heat of 100 degrees and it would feel like 80 degrees would feel like 100 degrees with humidity. So the humidity magnifies the heat. And if you're heat sensitive, the more humid it is, the more quickly you get to a point where the heat is a problem. Melissa from Facebook asks, what have you heard about the tau patch? If you read the testimonials about it, it sounds absolutely wonderful. And yet everybody, virtually everybody that I've talked to that's tried it says it does absolutely nothing, which leads me to believe it's probably a money-making scam. Question concerning spasticity from Jim. Jim's using baclofen, 20 milligrams, has been using it for about 15 years. And recently, his neurologist added tizanidine, which is also known as Xanaflex. Is it okay to take both? And if so, should it be taken at the same time or one in the morning and the other at night? That's a question your doctor needs to answer for you, because if they've added this extra dose with the tizanidine, it's probably because the baclofen's not working as well for you. I personally take tizanidine at bedtime, but that's the only time I take it. I find that the tizanidine makes me sleepy enough that I don't function well during the day. Also, baclofen at 20 milligrams is probably going to make you quite sleepy. I would say probably you would take a smaller dose in the morning in order to knock that spasticity down a little bit, and then a larger dose near bedtime, but you need to get that direction from the doctor that prescribed it. Let's see. Kathleen says it was with a speech therapist. That's her cognitive therapy. Did you, Kathleen, I'm wondering if you gave that feedback back to the speech therapist, because if it's not working for you, they need that feedback so that they can tweak what they're doing with you. And I don't know if it's to keep working or if it's just to help you outside of an actual work setting, if it's just to help you cognitively in the home environment. So I really can't answer that any more fully, but a speech therapist is the person to work with on that. An anonymous attendee says, I have frequent headaches. My neurologist has suggested I take a combination of magnesium and B2. I'm wondering if you're meaning B12. However, I also have irritable bowel, and I know that magnesium can bother people's digestion. What can I expect when taking magnesium? Magnesium can be very helpful for things like muscle spasms. And oftentimes headaches are caused by muscle spasms in the neck, tension headaches. I would think that that's why they recommended the magnesium. The magnesium itself, unless it's a tension headache, doesn't really help the headaches all that much in my experience. Okay, let's see. Jeannie says, why is it common to have urinary tract infections and constipation, and what helps to prevent it, meds and or food? Urinary tract and constipation symptoms often come from spinal cord lesions in the lower thoracic spine around T11 or T12. Sexual dysfunction also comes off that same nerve root that feeds the pelvis. So if you have even a small lesion in that lower spine area, the lower thoracic spine, that may be causing some slowing of response for all of that. Constipation, you really need fluid intake. You need to be drinking at least 8 to 10 glasses of fluid every single day. You also need to be working with extra fiber, things like Metamucil or Benefiber, certainly far more fruits and vegetables than meats or animal products. You really want to err more strongly on 3/4 of your food intake should be raw vegetables or lightly cooked vegetables and not something that's mushy out of a can, because you're losing most of your fiber benefit from that. I have many doctors that I've heard say that everyone, including those that don't have MS, needs to be taking fiber supplements every day. It's that important. And papaya, Jeannie also says papaya helps with her constipation. I've also found that beets, for me, help with that. And I don't know, it seems to me to be the vegetable that helps get things moving more readily than any single food that I've tried. Let's see, another anonymous attendee says, I have a new neurologist who wants me to consider changing from Ocrevus to Kesimpta. I haven't had any problems with Ocrevus, and I've read some pretty negative comments from people regarding the side effects of Kesimpta. Do you have any experience or thoughts about Kesimpta for primary progressive MS? I'm 70. If you're 70 and you're on Medicare, Kesimpta probably will not be covered, and you'll have a copay of over $2,000 a month. That's been my experience with the Medicare Part D programs. Any of the medications that are self-administered fall under that, unless the doctor's going to order the Kesimpta to be in the office for you to be going into the office and getting the injection. So I would say Kesimpta is not recommended for primary progressive. Ocrevus is, Kesimpta is not. So I would have that, revisit that conversation with your neurologist. Joe Marie says, I'll be on an 8-hour flight. Please recommend what I can do for movement and other helpful suggestions you may have for me. Certainly when you're sitting there on the flight and you can't be moving, doing ankle flexes, foot rotations, walking in place, all need to be done at least every 10 or 15 minutes while you're sitting. If it's quiet air and the seatbelt sign is off, certainly get up and stand in the aisle, maybe do a few squats. make relatively frequent trips to the bathroom. So I think those are the basic kinds of things. When I've been on a transatlantic flight, the stewardess actually, or the flight attendant actually goes through that type of exercise before we take off. James said, new COVID vaccine, any thoughts or recommendations from the MS community? The new COVID vaccine is not a booster. It's going to be our annual COVID vaccine, just like we now have an annual flu vaccine. In fact, I got both of mine about 4 hours ago. They actually have run out of it at the local vaccine centers at the drugstores near where I live. Last year, when the latest booster, the updated booster came out last fall, only 17% of people in the United States got that booster. And so they underestimated what they were going to need with this new booster that's targeted at the Omicron variant, which last fall's booster was not. And when I was at the drugstore, there actually was a line of 8 appointments waiting to get their vaccines, and they've had to add extra staff to give it. It's been in such high demand. I don't expect that it's going to be potentially as problematic as maybe the first vaccines that you might have received, because by now you will have had vaccine exposure, and almost all of us have had COVID at least once. And so therefore, we've developed enough of an immunity to it that we're not going to get as significant a response to either the vaccine or to a COVID infection if we should get that. So my recommendation is that you go get it as soon as possible. Jody responds, taurine is an amino acid that has some studies that suggested it enhances oligodendrocyte maturation. It's been suggested that increasing it might boost MS medicines. I don't think it boosts MS medicines, but it may, as you mentioned in that description, Jody, it may encourage a more rapid development of oligodendrocyte, which is the cell that covers the nerve sheath that's damaged in MS attacks. So we continue, in the absence of inflammation, all of us continue to repair myelin. However, you have to knock down the inflammation in order to repair myelin. So that's going to mean taking your disease-modifying therapy to knock down that inflammation. It's also going to mean reducing inflammation by eating an anti-inflammatory diet, which means knocking out all those processed sugars. You can handle the sugars that naturally occur in your fruits and vegetables, but not the added sugars in processed foods. So keeping those sugars out of your diet is going to be most helpful to that. I don't think there's any problem in taking the taurine or any of the amino acids because they're relatively natural products, provided they haven't been too added on to, provided they come singly and not as part of a composition of vitamins and minerals that you're taking. Let's see, one more in the Q&A. Oh no, that was it. So we have no more questions in Q&A or in the chat. I don't know, Bhavya, has anything popped up on Facebook?
Oh. No, there's nothing except the one I sent you.
Okay, great. Ree asks how I feel about juicing. I personally love it. I never thought that I would, but when I got my NutriBullet and started just, I actually tend with the NutriBullet to make a vegetable smoothie. I find that pineapple will sweeten even the most bitter raw vegetable. And so pineapple has been part of that staple for me all the time. I don't know, other than the fact that you're getting that fiber. Juicing doesn't give you the fiber that blenderizing those vegetables do. And fiber is so important to keep your bowels moving, to keep things moving. I don't think it's, other than the fact that you're getting more fruits and vegetables, I'm not so certain that it has a major impact on MS, but it certainly can be delicious. Jim says, thanks for being here. Well, you're more than welcome, Jim. Happy to be here. For those of you that may not have been aware, my first episode with MS was back in the fall of 1975. And it wasn't until 1994 that I finally was diagnosed with MS. I didn't have insurance a lot of those intervening years. And so, because the diagnosis of MS can be very costly, it wasn't until, for the fourth time, I lost the vision in my left eye for a period of time that lent itself to the diagnostic process. And from the time I saw my eye doctor, and he diagnosed optic neuritis, till the time I had an MRI and got to an MS center and was diagnosed, it was just over a week. So diagnostic process takes time because you have to rule out a lot of other things that look very similar to MS and that can produce lesions in the brain. MS lesions are very specific, however, in very specific areas of the central nervous system, and they need to be in specific positions in order to really qualify for the MS diagnosis. Anonymous says, studies show that clemastine may help to repair myelin. What are your thoughts on this? So far, the studies that are showing that could be helpful are on animal models. Nothing has translated to human testing. So for now, it works in the animal model, but not in humans. James says, in areas that do have an MS specialist, it's advised to make a trip to see one. I was able to meet with one when diagnosed, and he agreed with my neurologist on my plan. That was 5 years ago. I strongly recommend that even if you've got to make an overnight trip to get to the nearest multiple sclerosis center, that you make an appointment with an MS neurologist, because they know so much more about treating MS than our general neurologists do. We do have a couple of general neurologists near where I live that have 200 or 300 patients in their practice with MS. And when they do that, then there's one doctor within the neurology practice that handles the majority of MS patients. And those doctors tend to be extremely good in treating MS. But I would say that it really serves you well to go to an MS center, at least to get a plan developed, and they can share that with your neurologist if you don't live in an area where there are many MS neurologists. Diane says, I have MS and arthritis. I'm in pain daily. What can help with my pain? Again, Diane, cutting out all of the sugar in your diet can help to ramp down the pain. You're probably going to not notice the impact of that for 3 or 4 weeks after omitting the sugar, but you will notice that the pain is ramping down from that. And I would speak with your rheumatologist too about pain management. Arthritis is joint pain. That's not MS unless the joint pain is related to spasticity, pulling on a joint. And oftentimes that can be relieved with certain exercises. An occupational therapist could be giving you some exercises if the pain's in your hands. That could be working with that. Oftentimes also For hand pain from arthritis, paraffin baths, a warm paraffin glove, just dipping your hand into warm melted paraffin and letting that heat soak into your hands can help. Soaking your hands in warm water or putting a warm wet compress over the area of joint pain also can be very helpful. An anonymous attendee says, in general, are there any comments on using collagen supplements and fish oil? Are they helpful in any way? Probably not as far as the MS is concerned. The fish oil is certainly been shown to be helpful as far as maintaining cardiac health. And one of the big things when you're living with MS is to make sure that you're managing all the other comorbidities or other conditions that you have, because anything that is not well managed adds to the burden of your MS symptoms. So if you've got high blood pressure or diabetes or thyroid disease and you get those conditions well controlled, it tends to ramp down the impact of your MS on you as well. But collagen supplements, no. Fish oil, yes, as far as cardiac ramifications are concerned. Linda says, you know of any connection between MS and osteoporosis? The big connection, Linda, is that osteoporosis has a direct link, as far as MS is concerned, to our use of steroids to knock down the symptoms of our MS. The more steroids you have, particularly if you're a woman, the greater the chance of developing osteoporosis. My first steroid infusions were the month before I turned 50. And in that next 24-month period, I had 38 grams of IV Solumedrol prescribed for me by my neurologist. 2 years later, I started breaking bones. And in that next 2 years, I had over 70 fractures. So I broke 5 teeth and had to have crowns or extractions as a result of that. So keeping your steroid use to a minimum is important. If you're a female particularly, and after the age of about 45, you want to keep the steroids to a minimum. That's not to say that you should never take them. If there is a paralysis below the waist, a total paralysis, you're not able to walk, you may need steroids to get around that. If you have a total vision loss, you may want to introduce the steroids to get that back. So that's a conversation to have with your prescriber. Gus says, I've been diagnosed 9 years ago. I don't have any of the symptoms that many state with MS, foot drop, bladder fatigue, etc. Do the symptoms eventually arrive with time? They can, but if you're on a disease-modifying therapy, you just may never notice too many of those symptoms. I'm not sure what got you your diagnosis of MS as far as symptoms were concerned, or if it was just a finding related to some other testing that had been done. If you're not on a disease-modifying therapy, yes, you pretty much can be guaranteed of some symptoms developing over time, particularly 10 years after diagnosis and forward from that. Jim says, FYI, freeze your fish oil capsules. They're less likely to get a fish oil burp. There's also a formulation with your fish oil capsules that's called odorless. I know that Nature's Promise and Nature Made have an odorless fish oil, and you don't get that fish oil burp with it. Renee says, are there any Ree says, are there any AFO, that's ankle, foot, orthotic braces for people who have very large legs? Also, they are heavy. Are they heavy? My PT thinks it would be heavy on my foot. My AFO is a carbon step-off AFO, and it weighs less than 1/4 of a pound. and it's specially made for me. I would not recommend ever buying an AFO off the shelf, although they do sell them online. There are orthotists or orthotists who will make those AFOs for you specifically. And as far as I'm concerned, that's the only real way to go that's safe. And to get something that fits you and that works well for you. Let's see. Betsy says, do they ever skip the steroids on patients getting Ocrevus who've been taking it for a couple of years or more? And the answer is yes, more and more I'm seeing that. Most of the side effects that I hear from people as far as the Ocrevus are concerned are from the steroids. The fatigue, the insomnia, the achiness are all side effects of getting that steroid pre-med. So if you've gotten through your first year, so that first 2 half doses and then 6 months later a dose, and you don't have any major itching's the big one, then you may be able to go to a pre-med of something like Tylenol and Benadryl. More and more people are getting that pre-med now instead of a steroid. An anonymous attendee says, I use Nature Made fish oil. Yeah, Nature Made is very good, as is Nature's Bounty. The drugstore brands, the CVS or Walgreens brands, Rite Aid brands are also very good. An anonymous attendee says, what regular tasks can a partner of someone with MS undertake to help ease symptoms or reduce the likelihood of new or worsening symptoms? That's kind of a near and dear to my heart one. I tend to be very focused on task at hand, and I can be overheated. My husband will notice that I'm getting flushed, or that I'm getting anxious, or that I'm forgetting words. And he'll have to be the one to remind me sometimes to cool off, to take a long cold drink, to put on my cooling vest. Certainly a care partner knows you oftentimes in ways that you may not even know yourself, and they can see the signs that you're beginning to unravel, and can cue you that it's time to sit down, to put your feet up, to get a tall cold drink, to put the cooling vest on, those sorts of things. Also, if there are certain tasks that flare your MS symptoms more than others, for me, even with a lightweight cordless vacuum cleaner, I still have some problems with low back and hip pain. And so my husband has taken on the role of doing the vacuuming. That's now one of his jobs within the house. So perhaps just sitting down with the two of you and going over the list of things that you each do and seeing if maybe swapping some of those chores might not be helpful. Just, it takes dialogue. It takes a conversation. Julio from Facebook asks, have you heard about the blood MS disease activity test, the Octave test? Blood MS activity test, I think Octave is a company, and I think what you're talking about is neurofilament light chains. Neurofilament light chains looked like it might be a specific test for MS 5 years ago. What we're finding now is that that blood test is elevated in Parkinson's, it's elevated in stroke victims, it's elevated in some dementias. So it can cue us into the fact that there may be an inflammatory central nervous system disorder ongoing and have us looking more closely, but it's not a definitive blood test for MS. Okay, let's see. Another anonymous attendee says, on my most recent Ocrevus infusion, we reduced the steroid pre-med by 50%. I always take Benadryl. This time Tylenol was added as well as Pepsid. I didn't realize Pepsid is an antihistamine. Yes, it is. When I get IVIG infusions, they give me Pepsid and IV Benadryl as my pre-med, and I also get a couple of Tylenol with that as a pre-med. That's often a very standard pre-med for either Ocrevus or Rituxan. So, yes. Let's see. Jeannie says, MS and menopause. How can I tell which one is giving me issues? For example, I run cold, so hot flashes seem not to bother some, not to be bothersome, thankfully. When I had hot flashes, they were very bothersome because I tend to be extremely heat intolerant. So I would think that the mood swings probably are related more to the hormone changes than probably to the MS, unless you have a history of mood swings because of, for example, frontal lobe lesions. So in the upcoming issue of the MS Focus magazine, the next one to come out, there's going to be in the Ask the MS Nurse column, that's going to be 2 pages completely devoted to questions and answers about the impact of menopause on MS. So look for that magazine to come out. If you're not on our mailing list to get the print edition of the MS Focus magazine quarterly, go ahead and send off an email to support@msfocus.org and give them your mailing address, and they'll put you on the mail list to start receiving the hard copy. If you go to msfocus.org/publications, you can read the online magazines in their entirety for the last several years. So everyone tends to kind of have a theme now. So this last one that came out this summer was on relationships. And so you can basically find information that you're looking for within that magazine. Jim says, MS and old age. I just turned 60. Getting old is not for sissies. I agree. I just turned 71 a few weeks ago. And I never thought 71 would look like this, but it was 27 years into my MS journey before I ended up getting onto a medication. And at the time that I was put on medication, there were only 3 choices available. All of them are what we now term to be low efficacy medicines. At the time, they were all we had, and so they were good. They reduced relapses by 30 to 40%. And the medications that we've got now are reducing that relapse rate by 50 to 90%, which is minimizing the inflammation in the central nervous system, as well as any dietary changes that we make that help to minimize that. And so I just feel really blessed that I've had doctors that have been willing to try meds with me that are off-label, that were prescribed for new MS, early MS, and not a more advanced form of MS. And I actually have gone from what I believe was secondary progressive MS back to a nearly asymptomatic form of relaxing remitting MS. So I would recommend that at whatever stage you are, if you're not on medication, you ask for a consult on that. Diane has her hand raised. So Diane, I'm going to allow you to talk. If you'll unmute yourself, we'll let you ask a question. Diane, you have to hover over the lower left-hand corner of your screen and unmute yourself. Diane?
Muted. I unmuted
Okay.
me.
Good, thank you. Go ahead and ask your question.
Oh, I did. I asked you about arthritis and MS. I have both very I'm in pain 24/7, and I don't know sometimes if it's the arthritis acting up or if it's the MS acting up.
Okay, did I not address that for you well
Yes,
enough?
ma'am. Yes,
I
ma'am.
did. Okay, fine. You can lower your hands now. Just hover over that raised hand area and there'll be a lower hand.
Okay.
All right, thanks, Diane.
Uh-huh.
Go ahead and mute yourself again if you wouldn't mind, please.
Okay, I gotta figure out how to do that. Okay.
Hover over the lower left-hand corner and click on the microphone icon. Okay. An anonymous attendee says, can you comment on timing for COVID and flu vaccines relative to Ocrevus infusion? If you have been on Ocrevus over time, it doesn't seem like it's really necessary anymore to look at timing. If you're brand new to Ocrevus, I would get your vaccine about a month before the dose. The reason I say that is that particularly during the 3 years since the COVID pandemic broke out, those of us that have been testing MS patients for their antibodies, those of us that have been testing patients for their B cells, the population of their B cells prior to giving them a dose of their anti-CD20 medicines such as Ocrevus or Rituxan or Briumvi or Kesimpta. We're finding that those people that have been on these drugs for 2 years or longer, it doesn't seem to matter when we get the vaccine. It doesn't impact our antibody production or our blood levels of those B cells. If you've been on the drug for longer than 2 years, it seems like we're kind of leveled off at that point. So you can get them anytime. I have heard a recommendation that for the flu vaccine, we're going to get the biggest bang for the buck if we wait until probably early to mid-October to get that flu vaccine. Now, both your COVID and your flu vaccines can be taken at the same time. They're both going to take about 2 weeks before you get the full benefit of the vaccine. And keep in mind that those of us that are on those B-cell depletion medicines that I just mentioned are not going to probably get the same benefit as somebody who's on one of the injectable medications. I'm not talking Kesimpta, but I'm talking things like Avonex or Copaxone or Rebif. Any of those types of medications, you're still going to get a good response to your vaccine. You're probably also going to get a very good response to the vaccine with any of the oral medications. It's just, and also with Tysabri. So it's just really with that small group of B-cell depletion medicines that you're going to get a response, but you may not get a real robust response. We do know that the T cells tend to be activated also with those vaccines, and they tend to be protective to a degree. So you may not get that severe form of COVID if you do get it, even if you are on one of those drugs. So thank you for that question. And I just see a couple more questions have popped into the Q&A. Jody says, thank you. Kathleen says, thank you. Helpful as always. So you're very, very welcome. Our next program, Deb is ticking the information into the chat. Oh, Tuesday, October 3rd at 5:30 p.m. Eastern Time is our Spanish program. And it's Dr. Angel Chinea, MD. And Dr. Chinea is an MS neurologist from Puerto Rico. So he will be presenting a program on Tuesday, October 3rd at 5:30 p.m. All right, that is it. We are done, folks. Thank you, and please take a second once this webinar ends and answer a brief survey that will appear on your screen. We really try to keep our programs in line with what you tell us you need. So there'll be a place in that brief survey for you to tell us what you would like us to present in the future. Thank you so much and have a wonderful rest of your day.